to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary D. Bartolo, Professor of Nursing at Salisbury University and host of the program. I welcome back Lori Brewster. Thanks for coming in.
No problem.
You're a very busy woman because you are the health officer at the Wicomico County Health Department. And in your background, you are an advanced practice nurse in psychiatric and mental health, and you also are a licensed clinical alcohol and drug counselor.
Yes.
And you are here primarily because you're in charge of the county health department that is overseeing strategies to address a serious problem, and that being opioid addiction that's going on across the country. It's a nationwide problem.
Yes.
So you and I chatted and decided it would be a good idea to do a show to talk about the problem and also all the things that Wicomico County Health Department is doing to address this terrible issue that doesn't seem to be getting any better. So let's start first with, why did this all come about? It's been an epidemic in the making, and I know there's a lot of discussion about it.
A whole lot of discussion. Back in the late 90s, early 2000s, pain was one of the areas that doctors and hospitals were being evaluated on. So there was a concerted effort to address pain management, which led to the development of oxycodone for pain management. And at the time that oxycodone was developed, they said that the manufacturers said that there was no addictive quality to the medication. So we had a series of pain management practices, prescribing, and when individuals could no longer get their oxycodone or their Percocet from the doctor's office because of the crackdown on some of the overprescribing, individuals started using heroin.
And heroin is cheaper.
Absolutely cheaper.
Now, they can still get some of these medications on the street, obviously, and of course, OxyContin's another one, and that's
Yes.
more of a long-acting form of oxycodone. So we have a serious problem going on with access to these medications. Do you think there's been a reduction in the actual prescribing of it of late, and now we just have all these medicines on the street and so forth?
We have seen some decline in the prescribing. The Center for Disease Control came out with some prescribing protocols for pain management drugs, so we have seen some decline, but hoping for more. And what we're also seeing in the youth is these, what they're calling farm parties, where they're going into their parents' medicine cabinet and just getting whatever drugs are in there, and they take them and put them in a pile at a party, and they don't even know what they're taking.
Yeah, that's a whole other issue, I think.
Absolutely.
Addressing other things. But now we know it used to be we always talked about morphine. That's not really in the picture very much anymore. It's more of these medications you can get by pill. And what about fentanyl? We hear a lot about fentanyl.
Yes.
And what is fentanyl? And
fentanyl is another opiate that had been typically used for pain management related to cancer. Fentanyl is being manufactured overseas in some of the clandestine labs and being shipped into this country because of the market in this country is absolutely huge for these types of drugs. And fentanyl is cheaper than heroin as well. And they're using the fentanyl to cut the heroin, so an individual that may think they're using straight heroin may be getting fentanyl, and that's what's leading to a lot of the overdose deaths.
I know they say fentanyl is at least 100 times stronger than just morphine.
Yes.
And what about carfentanil? We've been hearing about that.
Carfentanil is an elephant tranquilizer, and it is very, very powerful and can lead to an immediate overdose death by any type of inhalation of the drug. It has no medical use in the United States, but they are using it to cut the heroin as well because it's so cheap. But we haven't had any thus far in Wicomico County.
In Wicomico County, yeah. I know they're saying a lot of these clandestine labs are located in China and so forth, so I know there's been a lot in the news about cracking down on that. It just seems like an uphill battle.
Absolutely.
So I guess we're here to talk about what can be done locally to address the issue, which is under your purview.
Mm-hmm.
But before we get to that, talk to us a little bit about what are some of the treatment strategies for people that have an opioid addiction? And that's either with the pills, you know, the oxycodone and so on, or once they proceed on to heroin, say, or fentanyl. There are some strategies, correct?
Absolutely. There are medication-assisted treatment programs where they can be admitted for methadone administration, which is a daily administration of a pill, or not a pill, but a liquid that we have to watch them drink. There's also our Buprenorphine program, which is a program that provides a prescription pill for individuals to take. And they can get a few days at a time until they have stabilized on the buprenorphine. We also have a program that offers Vivitrol, which is an injectable medication that helps with the cravings for individuals that have been addicted to heroin or other opiates.
But people would have to come to the health department to seek out treatment.
Not necessarily. There are other programs in the community that also offer all three of those treatments. What we do is we incorporate outpatient treatment, so they will come in for individual and group counseling as well as the medication-assisted treatment.
I would imagine the research says that the multi-pronged approach is most effective.
Absolutely.
To the medication plus the counseling and such.
Yes.
And I imagine there's groups available,
Yes.
Narcotics Anonymous and so on. That people can...
Well, they are support groups. They're not treatment groups, but we do encourage our individuals to attend those as well.
I guess any way you can address it. They say it's a very powerful addiction.
It is. The detoxing from an opiate is very, very hard on the individual. They get severe stomach cramps, sweats, nausea, vomiting. So it's like having a severe case of flu, and they just can't deal with that.
Hence they start using.
Absolutely.
It's hard, I guess, to really cross that line and make that decision. So they do need a lot of support.
Absolutely.
I know we wanted to talk, I had one statistic I found on the National Institute of Drug Abuse, and then I'll let you talk more about the county approaches and so on. But it says that fatal heroin overdoses rose 533% since 2002. There was 2,089 deaths, and now, as of 2016, 13,219 deaths. So heroin is really shooting up, and now I guess we're starting to get more statistics on the fentanyl issue, or the fact that the fentanyl's mixed in with the heroin.
Right. And the fentanyl issue is what is being attributed to the increase in deaths in Maryland. And the latest statistic is that there's about 6 on average overdose deaths a day in Maryland.
A day.
A day.
In the state of Maryland.
Absolutely. Wicomico County had 48 in 2016, and I always say one overdose death is one too many on my watch. Mm-hmm. But we have seen some successes with some of our programming, and we've seen a decline in the first quarter of 2017.
Well, that's one piece of good news.
Absolutely.
And I know that's the thing we wanted to emphasize. I'd like to give you the opportunity to talk about all the different programs and strategies and so on that you have in place to help with this.
Well, I think for the community as a whole, looking at the whole stigma associated with substance use, particularly the use of opiates, individuals don't necessarily access a lot of treatment because of the stigma that's attached to the disorder. So we're doing some anti-stigma education and campaigns so that people will feel a little freer in accessing treatment, or even family members who have had an individual die of an overdose. They don't want to reach out for help because of the stigma attached to that. So we're really focusing on the whole anti-stigma campaign at this point. We also have, for many years, had prescription drop-off boxes located in law enforcement agencies and now in some pharmacies, where once you finish a medication, prescription medication, you can take it to the drop-off box so that it's not sitting in your medicine cabinet for ease of access for somebody that may come into your house for a visit or spend the night for some reason.
And we mentioned open houses.
Yes.
Some addicts will go to open houses to see what they can find.
Absolutely. So that's one of the approaches that we've used that's been real successful, and we've collected thousands of pounds of unused medications. So if we can get that word out that any unused medications, I know, a lot of the older people always want to keep the medications in case they need it in the future so they don't have to purchase it. So we've also done a pilot project started in June of 2016 called the COAT program, and it stands for Community Outreach Addictions Team. And we partner with the Sheriff's Department as well as the hospital and the state's attorney's office. And we have peers, individuals that are in recovery, respond to law enforcement attended overdoses in the community, or we respond to the hospital for individuals that have overdosed. And we do that to be the bridge to treatment for those individuals so that we can ensure that they get adequate access. It's astonishing to know the number of people that don't even know where to turn for treatment. Most people know where they can get treatment for diabetes or hypertension, but we're trying to get that word out there as well and have these peers kind of help them navigate the healthcare system.
That's important for anyone to know.
Absolutely.
Yeah. I want to get back for a minute. You're talking about the stigma, and I know we were talking about heroin in particular. A lot of us just think of heroin as using it from the spoon, the powder, dissolving it, and using it from the spoon. You're saying that's a particular form, but now heroin's available to be consumed in various ways, and
Yes.
I think a lot of us are not familiar with that.
Well, those of us that are older think of the black tar heroin from the 60s, where they would actually melt it down and inject the heroin. You can now smoke it, you can snort it, you can inject it, and the latest thing is some of the drug dealers are putting it into a pill form and selling it as a prescription drug, which is even scarier because they're not using a prescription drug. They're getting heroin usually with fentanyl attached to it.
And you have no idea what you're getting.
Absolutely no
It's
idea.
a scary thing.
They don't even know when they're purchasing heroin that they're getting straight heroin because it is being cut with the fentanyl. And fentanyl is just so toxic to the system, and that's what's causing a lot of the overdose deaths in Maryland.
And you need such a small amount compared to the heroin to have
Correct.
a dangerous
So it makes it
outcome.
cheaper.
Yeah. So you're saying there's more of an emphasis also on reviewing all the overdose deaths now?
Yes. Wicomico County was one of the pilot counties in Maryland. There were 3 of us that began reviewing all overdose deaths that were occurring in our jurisdiction. And we have a team that's set up of all the agencies that you could imagine, human services, treatment providers, law enforcement, EMS, parole and probation. And we sit down and we review all of the cases as to who had contact with that individual. And in that contact, was there a place that we missed an opportunity to link them up with treatment? Now, most jurisdictions have a overdose review team, and it was actually put in legislation for confidentiality purposes.
So the Wicomico County Health Department is a place where someone can come, but your hours are such. What are your hours? And you say you have walk-in hours if someone's needing help?
We have walk-in hours first thing in the morning, and if somebody is in dire need of treatment, they can reach out. We can't always see individuals anytime that they need to be seen, but our COAT team can work with them until they can get access to treatment, whether it's through the health department or through another community agency.
You hate to miss that opportunity when
Absolutely.
someone's ready.
Yes.
I guess we need to also talk about the Naloxone training
Yes.
program that you have in place.
We have trained over 1,000 individuals in the community in the use of Naloxone, which is used as a reversal for an overdose. Brings someone back from an overdose death, basically. And it's an intranasal form of the drug, Narcan. And we know that individuals are using it in the community. We know that EMS is using it to bring people back, as well as law enforcement. And we do that training once a month at the library in the evening. And individuals can come to our training and get the Naloxone kit at the training, or they can go to any pharmacy and just ask for the Naloxone, and the pharmacist gives it to them under a standing order that was written by the state physician. So
are you finding it's more professionals, or is it family members that?
It's all across the board. We've trained most law enforcement officers, including Salisbury University Police. And of course, EMS has been using it for years. But like I said, we've trained about 1,000 community members, over 1,000 community members, and we still train them once a month.
So Lori, let's get back to the stigma again. I know you're trying to change people's attitudes, and that's a tough thing to do, especially because this goes for all addiction, as we know, whether it's alcohol or cocaine. People view it as a character flaw or a weakness. But this often starts out very innocently, where people are prescribed medications for a surgical procedure, and it can get out of control, and partly because the brain, the chemicals, it gets rewired because of the medications. Explain that in a little bit more detail for our viewers.
Well, I think the big issue is the legitimate prescriptions that are given for pain patients, either from a surgical intervention, a bad back, and they start taking it, and then they need more in order to get the same relief. So we see a lot of that, and then what happens is the brain chemistry gets rewired, and they can't manage the pain any longer. So they seek other sources because the physicians are not going to continue to prescribe the pain management medications that they had been prescribed previously. So that's when they go out and they seek other drugs to manage the same course of treatment, so to speak. Mm-hmm. And there isn't an equivalency of, if you're on this amount of oxycodone, you need this amount of heroin. So a lot of times that's kind of what leads to overdose. But it doesn't matter who you are. You could be upper middle class, you could be in any type of profession, and it could happen. And I think that that's one of the things that we want people to understand, is that it could happen to them or it could happen to one of their family members. And that's why we're trying to tackle the stigma associated with it.
It's tough, though.
It is.
It's just an uphill battle with that. And then you're saying with the heroin, it's so much cheaper to buy that. And now you're saying the fentanyl's even cheaper, yet it's so much stronger.
Right.
And it's being mixed in with the heroines. This is why we're seeing so many of these tragic deaths.
Yes. And of younger and younger people.
Yeah. Well, again, the health department seems to be playing a major role in our community, thank goodness. So let's talk about this scenario. Someone is ready for treatment and they come to the health department and you say you have services there. But what if you're closed? What are they to do? Where can they go or who can they call?
There's a substance use hotline. It's 211. And they can call that hotline and it will access any addiction or substance use related treatment service and give them options. It will also contact our COAT team if that's a necessary plan.
Because could they go to the hospital? Some people might think they should just go to the hospital emergency room, or is that not appropriate?
Well, it's not a true emergency. It may feel like an emergency in their mind, but it's not a true emergency. But they can access what the resources are that are available to them in the community by calling 211.
Okay, that's good information, and we'll certainly post that at the end where people can see numbers to call. And of course, your website, how can someone utilize your website? Is there a specific area they can go to learn more about your various services for people with addictions?
Our website has our programs and services that are available. It also has anything that's new occurring in the community, such as the county executive formed opioid intervention teams at the Wicomico County level, and that I'm the chair of that group, and what we're doing is developing strategies to tackle this issue. So, but they can see anything that's new that's occurring, whether or not it's a press release about a new program or just what new programs are out there.
And that's where they can get more information on the COAT program?
Correct.
You said that started out as a pilot and now it's been nationally recognized.
Yes. The COAT team started June of 2016, and in March we were designated as a promising practice by the National Association of City and County Health Officials, and we are applying this year to become a model practice.
That's impressive. Congratulations on that.
Thank you.
And you're saying some of the statistics are actually declining a bit.
They are. We're seeing approximately a 24% decline in overdose cases going into the emergency department. We've seen 8 fewer overdose deaths the first quarter of this calendar year. So yes, and we just recently had a formal evaluation done by Beacon on our COAT team, and they're showing for every dollar spent on the COAT team, it's saving $7, which return on investment of that is huge.
Yeah, it is. And of course, any life saved is a big accomplishment. So what's your final take-home message?
That there is hope, that people can get in recovery, and that it's going to take a little bit of courage and reaching out and avoiding the whole stigma associated with it, and contacting treatment providers or other resources through 211, and takes perseverance. You've got to continue to work on day-to-day recovery.
I know there's probably relapse that goes along with that, just like any other addiction, but as you said, there can be hope that people can get the medications and support they need to make a recovery.
Absolutely, and getting family members to understand the whole substance use process, and how they can help or how they can hinder that process.
Well, thank you so much, Lori, for coming on the program and discussing this tough topic, but so important.
Well, thanks for having me, because this is a very important topic that we think that we need to get the word out.
Just keep getting the word out.
Absolutely.
And thank you for joining us for this edition of Focus on Health here on PAC 14.